Today we are going to start with upper limb. This is the first lecture of upper limb. First of all, we will discuss about the parts of the upper limb. The upper limb consists of four. It is been divided into four parts. First of all, the shoulder region, then the arm, the elbow joint. It extends from the shoulder to the elbow joint. Then the forearm, it extends from the elbow to the wrist joint, and then the hand. The arm region of the we'll call it arm from the shoulder to the elbow joint. In contrary, in the lower limb, the leg is from the knee joint to the ankle joint. So the upper limb has four parts for the study purpose: the shoulder region, arm, forearm, and hand. The shoulder region is further divided into three parts, that are: number one, the pectoral region or the breast region on the front of the chest, then the axilla or the armpit region. Third one is the scapular region on the back, it comprising parts around the scapula. Before studying the anatomy of any region, it is usual to begin by learning the general features of the skin, the superficial fascia and its contents, the deep fascia, the bones, the muscles, joints, blood vessels, and nerves. Before undertaking the study of any part of the bone, it is essential for the students to acquire some knowledge of the bones of the region. To learn about the bones of the upper limb, you will have to watch the other videos about the bones of the upper limb. We will study about the clavicle, the scapula, the humerus, radius, ulna, the carpals, metacarpals. So you will study all of these bones in the upper limb. After dissecting the skin, we will encounter the superficial fascia of the upper limb. As we have discussed that upper limb consists of four further parts: the shoulder, the arm, forearm, and hands. The shoulder region consists of pectoral region, the scapular region, and the axilla. First, we will start with the pectoral region. The pectoral region lies on the front of the chest. It essentially consists of structures which connect the upper limb to the anterolateral chest wall. The mammary gland lies in this region. When we start to learn about the pectoral region, the students of anatomy should know how to do the dissection of the pectoral region. So, in the cadavers, when you are going to start the dissection, you will mark the following point. First of all, the center of the suprasternal notch. If you palpate in your own body, between the two clavicles, there is a notch you can feel. This is a surface landmark. This notch is called the suprasternal notch. The incision should start vertically down from the suprasternal notch. It is the first point to the second point to the xiphoid process. If you go downward from the suprasternal notch, you will feel a point where the sternum is ending. This is the xiphoid process. Make an incision from the suprasternal notch to the xiphoid process in the mid-sagittal line or median line. From the lower end of this line, extend the incision upward and laterally till you reach to the third point of the areolar margin. Spare the areolar margin. You will make a circular incision, and then you will encircle the areola, and then you carry the incision upward and laterally till the anterior axillary fold is reached. Continue the line of the incision downward along the medial border of the arm till its junction of upper 1/3 and lower 2/3 is met. Then extend the incision transversely. across the arm. After that, make another incision horizontally from the xiphoid process across the chest wall till the posterior axillary fold. Lastly, give horizontal incision from the center of the suprasternal notch to the lateral or acromial end of the clavicle. So you are going to make a incision horizontally from the xiphoid process to the chest wall till the posterior axillary fold, and a horizontal incision from the suprasternal notch laterally to the clavicle. Now reflect the two flaps of the skin towards the upper limb. Okay, now reflect these skin flaps towards the upper limb so that the inner structures will be exposed. This is how you are going to make the incisions for dissection in the pectoral region. For the before the start of the upper limb, you are going to dissect the pectoral region. By identifying the points and lines of incision, it will be easy for you to dissect the pectoral region. So we will study the pectoral region, skin, the superficial fascia in the next video. Thank you so much.